Dr. Mark Kerner, an orthopedic spine surgeon with Hampton Roads Orthopaedics and Sports Medicine, and this is a Facebook Live discussion of cervical problems and their treatments. Haven't done one of these before, and people let me know if this is helpful or interesting to you, and we can do others. So about me initially, I'm an orthopedic spine surgeon. I've been in practice for the past 25 years. I specialize in all aspects of care and treatment, both conservative and surgical spine issues. And I've been practicing here in southeastern Virginia, again, for the past 25 years. I'm an orthopedic spine surgeon, meaning that I'm board certified in orthopedic surgery, and I've done additional fellowship training in spine surgery. I spend about half to 3/5 of my week doing surgery itself, and the other half in non-operative patient care. I'm a part of a large team of orthopedic surgeons who take care of other aspects of orthopedic care if you're interested, and I have offices in Newport News, Virginia, and the Harborview area of Suffolk in Virginia. Those are both in southeastern Virginia. Cervical surgery, or treatments of neck problems, is a growing area, and there's lots of innovation going on in the treatments of neck problems. Obviously, neck problems can be, in essence, a pain in the neck, and that's what most people complain of. They'll have neck pain in their neck, and it will often radiate into their hands, down their arms. They'll have numbness and tingling. Sometimes they'll have dexterity issues. Other problems in the spine can cause neck pain associated with weakness and numbness in your hands and loss of dexterity, difficulty doing small actions, doing buttons, fastening a zipper. Can't tell the size of change in your hands, or you may find that your signature changes over time. People will find their balance altered from cervical problems. They walk like they had a couple to drink but didn't have the pleasure. And again, all that can be associated with neck pain, though sometimes the numbness, tingling, and dexterity issues are painless. If the process has been slowly progressing for long enough, there won't be necessarily any pain. A thorough evaluation is important before any type of diagnosis could be made, so I would recommend, before you jump off and start diagnosing yourself and signing up for an operation or something more significant, that you have a professional see you and evaluated and examined in real time, and very often that will be all that's needed. So most people with neck problems, neck pain is common. It could come from an injury, or you could just wake up with a pain in the neck. I've had patients who get neck pain just from a hard sneeze or a sudden turn. So it doesn't necessarily have to be something dramatic like a motor vehicle accident or the like. And they'll have neck pain and sometimes radiating into their arms. Now the good news is that most spine problems, neck problems included, get better spontaneously, usually over a couple of days, and 8 out of 10 people, in essence, get better in a 6 to 12 week period, no matter what we do. And so time and patience is often rewarded with improvement. And so there's no reason to flip out if you're hurting and it just started. It most likely will get better. However, if the pain is particularly bad, or you're associating it with neurologic changes, weakness or numbness, if you have other symptoms such as fever, or you're feeling very ill, or you've had weight loss or other things like that, it would be important to go see at least your primary care doctor, if not a specialist. So patients come in to see me with neck problems all the time, and we examine them. We check their range of motion of the neck, we check their strength and sensation, we check their reflexes, and we make a determination. Early in the course, most people with neck problems are well treated with physical therapy, some simple medications, anti-inflammatories, and modifying their activities, again, allow most people to return to their normal activities, period. And that's good for them. If the pain is continuing, or we note significant neurologic problems, radiographic studies could be obtained. We get plain x-rays to see the alignment of the spine. If there are obvious arthritic elements or deformity to your spine, if there's instability in your spine, plain x-rays will let us know that. Other studies like MRI studies are done, and that allows us to not only see the bones, but the discs, which are shock absorbers in between the bones, as well as the nerves that course through your neck and the spinal cord, and we can see if something's pinching or damaging a nerve. And we compare that to what your symptoms are to see if those changes are actually responsible for whatever's hurting you. Many patients come in to see me and they've had an MRI or X-ray that they've told is abnormal, and they're very worried about it, but the abnormality actually doesn't line up with what they're complaining of. People wear out like anything else. Just because your car has a scratch in the fender doesn't necessarily mean that that's why it doesn't start. So many times the abnormalities we see are just not meaningful at all. You really need to know what you're doing and have some experience to determine whether or not these abnormalities, which can be seen on a radiographic study, are the cause of someone's pain. So often, where do we go with someone's neck pain and arm pain? The initial treatments are conservative with physical therapy, medications, activity modification. If the pain continues or is particularly severe, we use different medications we call neuropathic medications, which makes the nerves less irritable. Sometimes we'll use muscle relaxants. Rarely these days do we use narcotic pain medications. They simply have not been shown to improve someone's outcome in the long run, and actually people who are utilizing narcotic medications for any length of time tend to do worse with other treatments, and so they're generally avoided at this time. If all that fails and you still have this pain in the neck and we don't know what else to do, and our radiographic studies would then be done to try to get some senses to a more specific diagnosis. I would caution anyone considering intervention for their neck to be very careful that the doctor taking care of them has been very specific as to determining what's wrong. A diagnosis is key for any treatment to work. And so any surgery that I do, by and large, it consists of two parts. We unpinch things that are pinched, and pinched nerves classically cause arm pain, radiating pain from a nerve, weakness and numbness. So if someone's having extremity pain, we generally are looking for something being pinched, and if we're going to fix it, we look to unpinch it. The other thing that people have is axial pain. That's pain in the neck itself. That often comes from arthritis, or it can come from what we call instability. That's from the bones not being well aligned or moving normally in relationship to one another. And for that, we do something we call a fusion classically. These days, we also do disc replacements, but in essence, we do a procedure that changes how the bones move in relationship to one another to try to help with that. Well, in order to do either of those things, to unpinch something that's being pinched or to stabilize something that's unstable, we have to know what's unstable and what's being pinched. And we have to be certain that that thing that's being pinched is the source of your pain. Very often we will see patients that have ugly looking pictures and have lots of things pinched, but are actually have no symptoms. Nothing hurts, nothing's weak, nothing's numb, and they've been like that for years. So just having something that looks ugly on an MRI or X-ray doesn't mean that you need a surgery, and it doesn't mean that that is actually what's hurting. On the other hand, we often also see patients who have remarkably normal studies, no real pinching, nothing unstable, and yet they hurt terribly. And in which case surgery can't help them because we're not certain what we're fixing, and yet their pain could be disabling. And so life's unfair with these things. Not everyone with a severe pain has something that can be fixed surgically, but for the right problem, surgery can be very helpful. For example, if someone has a disc herniation or something pinching on a nerve in their neck, we have treatments where we unpinch the nerves. That could either be done from a cut in the front of the neck, a small cut in the front of the neck, or a small cut in the back of the neck. Sometimes we unpinch the nerves by themselves. That's called a decompression. More often we do an unpinching of the nerve, and we do what's called either a fusion, where we get the bones to heal together on either side of the disc, or we do a disc replacement, where we unpinch the nerves but put something in there that still allows these bones to move normally, and that could dramatically help someone's pain.
We have a question. I don't mean to interrupt.
Sure.
Becky wants to know, can physical therapy unpinch a nerve?
Physical therapy doesn't actually unpinch the nerve. If something's physically pinching on the nerve, exercising doesn't stop that process from pinching. Your natural healing will. Sometimes physical therapy will improve your motion and stop the nerve from being as irritated when you move. And our nerves also get used to this irritation. In essence, if you've ever had a pulled muscle in your arm or leg and felt a cramp or stiff, you'll find that by starting to stretch it, initially you have some pain and discomfort, but then you overcome that and you feel better. And so we find that physical therapy can be very helpful in addressing pinched nerve pain, pain going down the arm. It gets people motion back and it makes them move with less inhibition, and allows the body's natural healing processes to continue to work. Most of what we do in conservative care, physical therapy and the like, is buying time in essence. We're trying to make patients more functional and more comfortable while all their body's natural healing processes are working. So I hope that answers your question.
Cool.
Moving along, so we do have things called disc replacements, which are surgeries that I do quite commonly where we take out the shock absorber from a neck. This is a model of a cervical spine. You can see bones, and in between the bones, there are discs. And through a small cut in the front of the neck, where we've been designed in such a way without really cutting much other than the skin, we can go down and address the cervical spine in a very minimally invasive way. Take out the shock absorber and any bone spurs that may be pinching on nerves and stabilize that area. In some cases, we do what's called a fusion. In this model, there's a device that's been placed between the two bones that the body heals through. In this case, it's a metallic device. Most often I use just pieces of bone that the body heals to itself. And that's done to unpinch the spine and give stability. So after surgery, that area no longer moves. It's sort of taken early retirement, and you're spared pain from that area. But because in our neck we have so many different discs and bones, each disc is only responsible for about 10% of our neck motion. So we could do a fusion on someone's spine and see almost no perceptible change in your functionality or range of motion. You can still play sports. Peyton Manning, the famous football player, had a cervical fusion and won a Super Bowl after having one. More commonly these days, though, I'm doing something called a disc replacement. That's where we go in there, and just like you've heard of artificial hips or knees, we're able to take out the disc and we put in a device that still allows motion. And that in several studies has been shown to be more effective in the long term because it allows normal motion to the spine. We see less wear at other discs in the neck, and so people are less likely to have other issues down the road. We know that about 1 in 4 people who have a disc problem in their lifetime will have another one in their lifetime. And so we try to do what we can to avoid secondary problems to keep you away from the doctor down the road. And there are a lot of other complex surgeries that are done both in the front and the back of the neck to unpinch nerves and to stabilize them. They range from surgeries that can take 30 minutes to an hour, where patients go home the same day, like a cervical fusion of one level or a disc replacement, to surgeries that take many hours, where people stay a day or two in the hospital because we're fixing a deformity or doing a more dramatic spine surgery on someone. And those surgeries can be longer. They could also be more painful, and they're just a larger operation. So that, again, is why it's so important to be very certain about a diagnosis. So we spend a lot of time with patients being certain about what their pain is, what their problems are, and trying to make sure that what we see is actually the source of it. Sometimes that's purely looking at pictures. Sometimes we use injections and other modalities to try to see if we can prove where someone's pain is coming from. So for example, if I think a pain is coming from a certain nerve that's being pinched, I may have a different doctor numb up that nerve and see if it takes away the pain. That can both help people decrease their pain, avoid surgery entirely, and sometimes it's purely diagnostic, where it's not meant to cure the patient, but it's meant to help prove to me where your pain is coming from, so I could be more certain that the fix I'm offering you will truly help you with your problem. Neck problems after surgery, patients generally have a good result. Most surgeries, I would say, of cervical problems that I do offer an 80% or higher success rate, meaning that patients are that happy that they had it done and would come back and do it again. They tend to not have a very painful surgical procedure and are back at work in short order. I'd say the most common thing is I tell patients that they can go back to sedentary activities after a couple of days. Most are back at work within a week or two, though the entire healing process can take months. I hope that answers some of your questions about cervical problems and its treatment, both through conservative care, physical therapy, medications and injections, as well as operative care such as decompressions, infusions, and the latest in disc replacement, or what's called disc arthroplasty. If you have any questions, I'm here in my offices again in Newport News, Virginia, and the Harborview area of Suffolk, Virginia, and I'll be happy to see you in person and try to help you out with your individual problem. Thank you.